So recently, we have been engaging with the industry, the MEC, as well as the FMM. So what we want to tell them is that for the Greater Klang Valley, the employers have a responsibility to engage with the employees for a few things. Number one, there must be an understanding that vaccination is the key. So get your employees vaccinated as soon as possible. Number two, all the employees who are symptomatic with signs must be tested. And we're also encouraging the employers to provide access to GP panel clinics for the employees. Because sometimes the employees do not have this large benefit. They have to pay to go to the GP clinics. And because of that, they may delay seeking treatment early. So if the employers can work together with the employees, if they know that they have symptoms, straight away test them. Now we have already the saliva test kit, I've repeated many times. This saliva test kit can be done on site. Quickly they will know whether they are positive or not. And then if they are ill, they should be referred to a healthcare system. And in the event that they are positive, we also advise the employers what to do. That is, if they are symptomatic, they must provide a place where they can be isolated, and all those contacts that are close to the positives, they should be isolated. Now, when you isolate a group of people, we also asked for the employers to have the responsibility of providing food or aid for them. Because sometimes when you quarantine a group of people and they can't come out to buy food, they will be left without anybody taking responsibility of the welfare. So the employers are agreeable to all these suggestions. And one important criteria in terms of the functioning of the industry is the Safe at Work, which is a program under MITI. Now we advise all the employers to register with MITI for the Safe at Work program, because in this Safe at Work program, they have ways to create safe bubbles and a safe environment within the factory or the work premises. So if they were to do that and cases comes up in that factory or that industry, the number of cases will be limited. And if you detect it fast, the number of cases will be less. If you delay in detecting those cases, the numbers will be more. So if they were to follow all these suggestions, I'm sure that the cases, even though it will be present, we cannot avoid those cases in the industries, but the numbers will be few. And then they need only to close for cleaning up and sanitization. Now that we have self-testing kits, if at all the people do it on their own, or in the industries we test it for employees, all positive cases must be notified to us, all positive cases. So those who do self-testing at home, they must go to My Sejahtera, and there is a button now to report your self-test. Now we encourage all negatives as well, all negatives and positives to be key into it, so that we can monitor you to see that you are well. But all positive cases must be notified to us. And for the employees, they also have an extra step, not only to ensure that the employees notify us through My Sejahtera, but also to inform the nearest PKD.